Now, I've been fortunate to be at a couple of these with you folks, and cannot stop marveling at how you just care for building community. It is truly an honor to stand here today. Thank you so much.
This is truly life-saving, completely transformative gift of a $5 million that is going to be used. It's incredibly overwhelming. I'm so incredibly grateful that the Yuill Foundation and the Yuill family would believe in the vision and invest in cardiac care in Southern Alberta and become partners in trying to change the outcomes in our region. Heart disease is the #2 reason for death in Alberta, but very unfortunately in Southern Alberta is the #1 killer. Our mortality rate in Southern Alberta is 26.6% higher than the rest of the province, which is not okay. We are desperately in need of more equipment, more services, and more cardiologists.
You know, we look for things to try to make the community a little better, maybe provide things they didn't have or different ways of doing things. And of course, healthcare is getting to be a big deal. The population is getting a little older. And down here, there's a lot of retired people. And so we just thought it was an opportunity to provide a service for them that would cater to them specifically. And that's why we were associated with the cardiac side. Dr. Zelke came down here and gave us a pitch a little while ago. She should be a soap salesman. She's fabulous. She did a great job selling it. So that's kind of what got the ball running, and that's why we chose this direction.
Major part of the donation will go on to provide preventative programs. So whether that's screening for high blood pressure, for cholesterol, provide education to the community in terms of how do we reduce the risk factors in the community so we can prevent heart disease. Some of the money will directly go to help establish hopefully an echocardiography laboratory, that's the ultrasound of the heart. Here in Medicine Hat Hospital, we would like to build a new coronary care unit, CCU, to provide critical care to heart patients here locally as well. We're really hoping that this gift also helps generate enthusiasm about the broader campaign of bringing hearts home. Our mission and our vision is to raise about $30 million over the next 2 years. So we would love to see this be an inspiration to the community so that everybody gets behind it and supports this further.
We wanted to match Lethbridge. Lethbridge hasn't quite raised the $5 million. So we thought, well, maybe we could start, maybe they'll catch up. Healthcare is pretty important to people. And, you know, we have to travel for most things. We get used to going to Lethbridge or Calgary or Regina. So if we can keep all that business at home, why not? So what can we do to make it happen in Medicine Hat? And at the same time, as I said in my comments, you know, we're just trying to make Medicine Hat a little better place to live. And all these little things add up. But other than that, it was just provide a service for people in Medicine Hat and area. When they get on later in life, they have some health care issues. So now when you're dealing with the cardiac side, there's a lot more service in Medicine Hat now than there used to be.